Hello everyone, today's video is about methylene blue. As always, lots of questions about this topic, so I'm going to try to work through a few of them here today. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question here says, can you please advise if a person can take methylene blue with ivermectin? I've heard promising information for both in cancer treatment. Do you think one is better than the other, or can they be combined? I just got bad news about a close family member. I'm trying to gather as much information as possible, and I'm currently using methylene blue myself for general cell health. So yeah, I'm sorry to hear about your family member. I wish them and you the best. And so, to my knowledge, there's no well, again, this is all for informational purposes only, of course, can't give any direct advice. To my knowledge, there's no interaction between methylene blue and ivermectin, at least from like a serotonin syndrome perspective. Ivermectin's not within our scope of practice here in Nova Scotia for naturopathic doctors. So while I have many patients who are on ivermectin, I'm not able to prescribe it directly myself. I'm not aware of there being any problematic interactions between methylene blue and ivermectin, but it's something where if I was going to put one of my patients on it, I would double check that was the case, but I'm not aware of there being any issues. Now, I don't believe that I have any patients who are on ivermectin and methylene blue at the same time, largely because most of the patients that I'm working with who are on ivermectin, again, not that I've prescribed it, but that they're taking it, it's typically for oncology purposes. Once upon a time when there were more rampant issues with a certain virus floating around, folks were taking ivermectin for other reasons. It's generally pretty hard to get an ivermectin prescription here in Canada in general, to my understanding, but it's definitely here in Nova Scotia where I am. Yeah, it's just not a very common medication that folks are on in general, but in the oncology population, seems to be more common. In terms of, the question of, is one better than the other? Can they be combined? One of the things that's a little bit maybe counterintuitive, but something that one of the reasons I wanted to talk about this a little bit longer in this video is I think it's an important topic, is just the question of antioxidants and oncology. Because on the one hand, if we're approaching sort of the oncology conversation from the perspective that we want the body to be as healthy as possible so it can try to rid itself of the cancer cells and have the best possible outcomes. On the one hand, it would make sense to make sure that there's adequate antioxidant status in the cells. On the other hand, there is some evidence to suggest that when antioxidants are consumed, that it can be a pretty great benefit to the cancer cells themselves. And there's a ongoing debate, and without a clear answer, to my understanding, in the integrative oncology world around, what should we do about the antioxidants? We certainly want to be cautious with the antioxidants around active treatment with chemotherapy and radiation therapy, but even just in general, there's concern that even if someone's not, working with those oxidative therapies, it may be a detriment to the patient in the grand scheme of things to kind of go too hard on, or to be too aggressive with antioxidant therapy. So I tend to approach antioxidants very cautiously in my patients who have a cancer diagnosis, and so I guess I'll just leave it there. Again, I can't advise specifically around ivermectin in this case or in any case, but it's something where in my own patient population, where I've worked with many hundreds of patients with cancer diagnoses over time, tend to be very cautious and use antioxidants very judiciously, modest doses, and for short tracts of time, if at all, and usually we don't typically use them when there's active cancer afoot. Any questions or comments on that? Feel free to post in the comment section below. Be curious to hear if anybody has any thoughts around that. Another question was, and I don't have the actual exact question up here in front of me, but the gist of it was, are there certain supplements that should be avoided alongside methylene blue? The question, if memory serves, was, the person who asked the question was presuming that 5-HTP and maybe SAMe, which is S-adenosylmethionine, should be avoided, and wondering about anything else. Generally, the supplements that we want to be cautious with methylene blue, at least to my understanding, are those that boost up serotonin. So 5-HTP is definitely on that list. And then also St. John's wort, which has kind of a natural SSRI, selective serotonin reuptake inhibition effect. So those are kind of the two biggest ones. The SAMe question is an interesting one because SAMe is involved in the synthesis of neurotransmitters, including serotonin. To my knowledge, it's not generally something that's on the avoid list or the no-no list when it comes to not combining with methylene blue, but it's a good question. To be honest, I really don't prescribe SAMe very often. I do in select cases, but it's something I don't use a whole lot of, and I don't think I've ever combined it with methylene blue with anyone to date, so I'm not sure about that one. There may be some possible need for caution with certain other nutraceuticals. I've posted in other videos before that maybe melatonin is something we need to be a bit cautious with because it is a serotonin derivative and it can potentially interconvert back into serotonin, so that could be possibly an issue. Tryptophan as a supplement might potentially be a problem where it's the parent amino acid of serotonin. And then there may be certain herbs that have a serotonergic effect that we don't necessarily know about, but certain calming herbs could potentially boost up serotonin, so there might be some concern there. I think in general, it's not something that I tend to be terribly concerned about with my patients because any serotonergic effect that some of those herbs might be having is likely going to be quite mild, and the monoamine oxidase inhibition effect of methylene blue is quite mild to my understanding, so a mild plus a mild equals probably not a big deal, but that's something that, of course, you have to suss that out with your own healthcare provider and see, what the best fit might be. But I think in general with supplements we're pretty safe. I think it's really more around pharmaceuticals that can boost up serotonin that we have to be more concerned about potentially. As I said in another recent video, that my understanding is most of the concern or issues around serotonin syndrome with methylene blue have to do more with intravenous methylene blue that's given in an emergency situation, and that's obviously not something that applies to most of us who are working with methylene blue, thankfully. And then there was another question of whether there's any benefits of methylene blue to the mitochondria. I spoke about this in a recent video as well, but just as a very quick reminder, to my understanding, there are significant benefits of methylene blue to the mitochondria. Methylene blue has a natural tropism / affinity for the mitochondria, which is really cool. And as I said in a previous video, I believe if we think of the mitochondria as kind of being like combustion engines that are generating energy for our cells, which they are, that combustion engine is going to create a little bit of pollution as well in the form of free radicals or pro-oxidants. And so having more methylene blue kicking around in the mitochondria can neutralize those free radicals as they're produced. So as the analogy I used in my other video, I believe, is if you are running a generator in your living room, which would generally be a bad idea so you don't give yourself carbon monoxide poisoning, it would be kind of like neutralizing that carbon monoxide as soon as it came, like all the exhaust as it came out of the generator, so that you have nice clean air while you're still getting the energy from the generator. So that's kind of what methylene blue and other antioxidants are striving to do, to my understanding. So a lot of benefit to the mitochondria. Can be a little bit of a double-edged sword. Some patients do seem to notice some detoxification effects for mitochondria. Many comments on other videos I posted about methylene blue where folks say, like, I felt really tired from this, I have brain fog, I felt anxiety, different things, and then other folks saying like it really helped them, and then some folks saying it did nothing, like anything can, help or do nothing, but then it can potentially, to my understanding, instigate some mitochondrial excessive detoxification potentially, and maybe some liver detoxification excess as well. So we just have to be a bit cautious with that as well. So, but generally, my understanding, quite good for the mitochondria. It's a lovely little compound, that methylene blue. I will leave it there for now. Any other questions about methylene blue? Please feel free to post in the comment section below. Any questions or comments on anything else, please post in the comment section below. And if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on this video, I would really appreciate it. So thanks in advance for taking a second to do that. Hope this video was of interest, and I'll leave it there for now.